and welcome. You're watching Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Osteoporosis is a global health problem, and because of this, worldwide fractures affect 1 in 3 women and 1 in 5 men over the age of 50. Our bones are living tissue that gives our body structure and allows us to move and protect our organs. Bones that suffer from osteoporosis become more porous and fragile, making them more liable to break, which can cause considerable pain and disability. Many people think osteoporosis is simply linked to old age. The older we get, the more chance we have of developing osteoporosis. While this is true in some ways, age isn't the only factor involved, and osteoporosis is linked to various other medical conditions. You'll be surprised to know that even hormonal imbalances can cause osteoporosis. Many hormones in the body affect bone turnover. If you have a disorder of the hormone-producing glands, you may have a higher risk of developing osteoporosis. The good part is that there is a lot you can do to protect your bones throughout your life. You're never too young or too old to improve the health of your bones, and by being aware of osteoporosis and which factors could place you at risk, you can make sure that you get diagnosed and treated as soon as possible. Today we have with us eminent endocrinologists who can help you understand and manage osteoporosis. We're joined by Dr. Vaibhav Vasudev Dukle, consultant endocrinologist, thyroid, diabetes and endocrine clinic, Panaji, Goa. Dr. Soumik Goswami, faculty, Department of Endocrinology, Neil Ratan Sirkar, Medical College, Kolkata, and Dr. Chavi Agarwal, associate consultant endocrinology, Fortis Escorts Heart Institute, New Delhi. Thank you so much, doctors, for joining us and talking about this issue and creating awareness. Dr. Dukle, I'd like to start with you. The hormones in our bodies regulate many important bodily functions. So how does an imbalance in hormone levels affect our overall health?
So hormones are the chemical messengers that are secreted by the endocrine system. They are carried by the bloodstream to wherever they need to act. We have various processes in the body, be it growth, development, metabolism, sexual health, reproduction, and even bone health. So all these are in a way regulated by these hormones. Too much or too little of these hormones can cause disequilibrium or disturb the balance of the hormonal system. So hormonal imbalance is a broad term. For example, let's talk about the thyroid. The thyroid maintains the pace of all the processes occurring in the body. Whenever there is an underactive thyroid, everything slows down, the metabolism slows down, there's weight gain, constipation, difficulty in concentrating, menstrual irregularities. When the thyroid gland is overactive, everything is opposite, like there may be weight loss, diarrhea, tremulousness, and hence we need to keep our hormones in check to maintain general bodily health.
All right, Dr. Goswami, now osteoporosis is one of the biggest health challenges. So what is the role of hormones in osteoporosis, if you could explain to our viewers?
So hormones have a very interesting role to play in osteoporosis because hormones play a role in bone formation as well as in resorption or destruction of bone. So in males, it's the androgens, primarily testosterone, and in females, it's estrogen, the sex steroids, which play a very, very important role in the formation of new bone. There is another hormone called the parathyroid hormone, which most of us are not aware of. Now, this hormone is secreted from glands in the neck called the parathyroid glands. When the parathyroid hormone is secreted intermittently, it helps in new bone formation. Interestingly, when the parathyroid hormone is secreted continuously at high levels, it causes destruction of bone. Another important hormone is cortisol, or popularly the steroid hormone, which plays a role in destruction of bone. There are other hormones like insulin, growth hormone, leptin. You have vitamin D as well, which is considered a hormone. All of these hormones, and of course the thyroid hormones, they play a very important role in maintaining good bone health.
All right. Now, Dr. Agrawal, we were talking about, age and osteoporosis, and as we age, we tend to take more and more medication. So can certain medications cause hormonal imbalances, which can then lead to osteoporosis?
Yes, definitely. There are a majority of drugs that cause hormonal imbalance leading to osteoporosis. The most commonly used antacids like pantoprazole itself, if it is used for a long duration, maybe over a year continuously, may lead to reduction in the calcium absorption in the body, leading to osteoporosis. Then other medication that has been used recently a lot in COVID and for other chronic conditions, and a lot of misuse of steroids in bodybuilding. Steroids are one of the common drugs that lead to osteoporosis. As Dr. Goswami has mentioned, it causes a secondary hyperparathyroid, that is increase in the parathyroid hormone, which results in the osteoporosis. Then apart from that, another class of drugs that is associated with osteoporosis is the anti-epilepsy medications. Most of the patients of epilepsy, they need replacement with calcium and vitamin D because of the osteoporosis. Then another class is anti-diabetics like pioglitazone, and cancer patients on chemotherapy can lead to osteoporosis.
All right, Dr. Dukle, when should a person consider consulting a doctor for evaluation of osteoporosis? Like, what are the signs?
So osteoporosis is a silent disease. We don't know that our bones are growing weaker, and most of the patients realize that they are having osteoporosis only when they have a fracture. So the only signs are loss of height, a stoop posture, low back pain, and these are all features of osteoporotic vertebral fractures. The commonest sites of osteoporotic fracture are the wrist, the hip, or the spine. So if any patient has any fracture in these sites, they must seek treatment for osteoporosis. In general, females above the age of 65 and males above the age of 70 should seek evaluation for osteoporosis, and this can be done by a simple test which is called as a DEXA. This estimates your bone mineral density. If you have other risk factors like some of the medications which were recently mentioned, or conditions like rheumatoid arthritis, inflammatory bowel disease, hyperthyroidism, if there is history of alcohol abuse or smoking, if any family member has had an osteoporotic fracture, then these are risk factors, and even at the age of 50 or more, we can evaluate for osteoporosis by simple tools like a FRAX calculator or a BMD estimation by DEXA.
All right. Now, Dr. Goswami, osteoporosis is less common in premenopausal women than in postmenopausal women. However, both fractures and low bone mineral density do occur in premenopausal years as well. So, how does perimenopause affect the bones?
Okay, so that's a very important question. I'll just explain first what premenopause and perimenopause is. Premenopause is the period when a girl or a lady is menstruating, that is, say from 12 to 13 years of age to 45 to 50 years of age. So in the premenopausal period, the lady or the girl has adequate levels of estrogen, the sex steroid, which I was referring to earlier. And this estrogen normally protects the bone and prevents fractures. However, there are certain conditions, like there could be a family history of fractures at a young age, certain genetic conditions which might lead to fracture even in the premenopausal age. There could be certain diseases like celiac disease, a disease of the gut. There could be diseases of the kidney, certain chronic kidney diseases. Hyperactive parathyroid gland could lead to fractures in the premenopausal period. A hyperactive thyroid gland could also lead to fractures in this period. So lack of proper exercise, prolonged immobilization, having very low body weight, the medications that Dr. Agarwal was referring to, if someone is on those medications for a prolonged period, even in the premenopausal age, there could be an increased risk of fracture. But usually it's not very common to get osteoporosis and fractures in the premenopausal period. Now, what is perimenopause? Perimenopause is the duration, which is usually a couple of years, preceding the last menstrual period and following the last menstrual period. So you could say it's the 1 year before menopause to the 1 year after menopause, after the final menstrual period rather. And during this time, we know that the ovaries cease to function. So earlier they were producing estrogen, now the estrogen production starts getting low. And once this protective hormone starts getting low, the risk of fracture starts increasing in the perimenopausal period. Additionally, certain other hormonal changes also take place in the perimenopausal period, like there is an increase in the level of a hormone called the follicle stimulating hormone. There is decrease in the level of other hormones as well, like progesterone, inhibins, activin, and all of these hormonal changes could contribute to an increased risk of fractures in the perimenopausal period.
All right. Now, Dr. Agrawal, can osteoporosis caused by hormonal imbalances be reversed then by a healthy lifestyle?
So osteoporosis, it cannot be reversed, but it can be definitely improved with a healthy lifestyle. And when I say a healthy lifestyle, it does not only mean eating healthy, but it also means that one should be doing a regular physical exercise. And the regular physical activity does help in improvement of the bone mineral density, but it has no definite effect on the reduction in the fracture risk. Now, the diet for a healthy lifestyle for bone health should be rich in calcium and vitamin D. But even with these adaptations in your lifestyle, the hormonal imbalance that has led to the development of osteoporosis will not correct itself. So first and foremost, we need to correct the hormonal imbalance. And even in some cases, even after the correction of the hormonal imbalance, the osteoporosis may not revert, and the patient might need a regular treatment with agents that correct the osteoporosis, like patients who have low sex steroids. They, even after correction with the hormonal steroids, they may not regain the full bone mass, and they may need treatment with the osteoporosis agents.
All right. Dr. Duclay, what is the difference between osteoporosis, osteopenia and osteoarthritis?
Okay, these are three similar sounding words, but they are totally different diseases. Osteoarthritis is one of the most common forms of arthritis. It is a disease of the joints. So there is the cartilage which cushions the joint, the ends of the joints, and when this is worn out, there is pain, there is joint stiffness, loss of flexibility, deformities, and this is called as osteoarthritis. On the other hand, osteopenia and osteoporosis, they are diseases of the bone. That is, there is a weakening of the bone. Osteoporosis is a severe form of osteopenia. And these two conditions are distinguished based on the test called as DEXA, where there is a score which is called as the T-score. This compares your bone with that of a healthy 30-year-old person. And if this difference is more than -1 to -2.5, this is called as osteopenia. And if it's more than -2.5, this is called as osteoporosis. Osteopenia is an important time to intervene, while simple measures like optimizing calcium, vitamin D, removing medicines that can weaken bones, or improving physical activity can prevent progression to osteoporosis. In general, if there is a mild osteopenia, it might take even up to 15 years to progress towards osteoporosis. And in advanced cases, it may take less than a year. So osteopenia is the critical time to prevent a fracture, and that is the whole aim of this test.
All right, we will slip into a short break now, but we have a lot more questions for all our doctors regarding hormones and our bone health. Stay with us. Welcome back. You're watching Health and Wellness. I'm Gargi Rawat, and we're talking about osteoporosis and the role of hormones and what we can do for better bone health. Let's go across to our doctors. Dr. Goswami, how can a person be sure he or she gets enough calcium and vitamin D in the diet?
That's a very important question because, as we discussed, these are needed to keep your bones healthy. So the sources of calcium and vitamin D are somewhat different if we look at the sources. For calcium, the total daily requirement is about 1000 milligram for most adults. And if you are a woman above the age of 50 or a man above the age of 70 years, you need 200 milligrams extra, that is 1200 milligrams of calcium. Now, the primary source of calcium in our diet is dairy products and milk and related products. So if you get a cup of milk regularly, and if you get a cup of homemade curd or yogurt regularly, you get about 50 to 60% of your daily dietary calcium requirement from these two sources. Some additional sources are cheese, of course, is a dairy product which is also rich in calcium. Green leafy vegetables are rich in calcium. Beans like rajma is rich in calcium. Soybean is a rich source of calcium. Fruits like oranges and figs are rich sources of calcium. Seeds, nuts and seeds, almond is a rich source of calcium. And if you are a non-vegetarian, if you take sea fish with soft edible bones, they contain a lot of calcium as well. Among other fishes, we popularly, the non-vegetarian fish eaters, they take fish like rohu, hilsa, morolla, or the Indian carplet. These are also rich sources of calcium. Now, if you look at the sources of vitamin D, the dietary sources of vitamin D are actually inadequate to fulfill most of our Indians' daily requirement of vitamin D. We require about 800 international units of vitamin D per day on an average to stay healthy. Amongst the dietary sources of vitamin D, you have a variety of saltwater fish like salmon, herring, cod, which are not popular in India and which are not easily available in most parts of India as well. Egg yolk is a source of vitamin D, but again, it fulfills just about 5% of our daily vitamin D requirement. Fortified milk, fortified cereals with vitamin D, if they are available, they can provide some vitamin D as well. Wild mushrooms, which again are not very popular, can be a dietary source of vitamin D. So as I said, diet will not provide your entire vitamin D. So from where do we get our daily vitamin D? So we know that vitamin D is also known as the sunshine vitamin. So we humans can produce vitamin D in our skin using the ultraviolet rays of the sun. So adequate sunlight exposure, at least half an hour of exposure between 10 in the morning to 2 in the afternoon, on at least 4 to 5 days a week, exposing your arms, exposing your legs, your neck, your face, would more or less be sufficient to fulfill your vitamin D requirement. If you still don't have adequate vitamin D levels, you can get a blood test done. And if your levels are low, you need to take supplements in the form of capsules or tablets or powders, vitamin D supplement to get your daily vitamin D fulfilled.
All right, so that's as far as the diet goes. Let's talk to Dr. Agarwal now about exercises. So, Dr. Agarwal, which exercises are best for our bone health? Can you share some safety tips for exercising with osteoporosis?
So exercise in any form will be good for your bone health. But if we want to discuss about specifically for bone health, it will be aerobics, weight-bearing exercises, and resistance training exercises. So aerobics mainly, when we talk about aerobic exercises, it means the dancing in any form or the Zumba classes. So a patient who's interested in that form of exercise can definitely, these can definitely help in your bone health. And weight bearing and resistance exercises, that is using the weights that are commonly available in the gyms or in the market. If you want to do it them at home, you can do weightlifting. And apart from that, the resistance exercises like the pull-ups, the push-ups, and any form where your muscles are acting against a particular resistance, they will help in improving the muscle mass. So, and the increase in muscle mass will in turn improve the bone health. But in general, if you are regularly exercising, staying fit, jogging, running, dancing, even simply stair climbing, all these forms of exercises will help in your bone health. But for a patient who's already developed osteoporosis, they should be cautious because certain forms of exercises may lead to fractures because these patients have fragile bones, and if the exercise is not suitable, they may end up with a spine fracture or a hip fracture. So any form of movement that is jerky or rapid, they should be avoided in patients with osteoporosis, especially the severe forms. And any exercise where the patient needs to bend forward or twist at the spine, the waist, they should be avoided. Then overhead weightlifting or lifting a weight away from the body These forms again should be avoided because they put pressure on your spine and may lead to fractures in the spine, because that is the most common site for patients of osteoporosis to develop fractures. So these kinds should be
Right.
definitely avoided. And yeah.
Right. Dr. Dukle, will estrogen replacement therapy help to prevent osteoporosis?
That's a good question. Estrogen, as we know, shifts the balance from bone resorption to bone formation, and hence most of the women until the age of menopause, their bones are protected. Initially, estrogen was thought to be a very good drug for osteoporosis. However, with several studies, there were some risks which were highlighted, mainly in terms of stroke, cardiovascular disease, blood clots, even breast cancer. So, this is not for only fracture prevention. In some women who have early menopause, that is before the age of 40 or 45 years of age, hormone replacement therapy is given, and of this, estrogen is an important component. In these females, also we try to give it in the lowest possible dose for the shortest possible time to minimize the adverse effects, and it does help to prevent bone loss and mitigate the risk of fracture in these women. So to summarize, it's not for every patient for osteoporosis, because
Right.
we have better drugs available which can be given more safely.
All right. Well, thank you so much, doctors, for joining us and, shedding light about this issue and about our bone health. Thank you all for watching at home. Goodbye.